Meet Dr. Bowers, a UConn employee in the speech and hearing clinic. She previously played a key role in selecting a vendor to provide patients with the appropriate hearing devices and hearing testing equipment. After 5 years of serving the university, the vendor asked Dr. Bowers to work for their company as an essential member of the sales team. What do you think? What are some things Dr. Bowers would need to consider before accepting the offer? We'll give you some time to think about that. As you reflect on that specific scenario, let's take a look at the State Code of Ethics, which outlines certain post-state employment rules, including lifetime bans and one-year bans. Because such rules apply to all of us, it would be important for Dr. Bowers and other UConn and UConn Health employees who are considering leaving their position in state service to be aware of them and seek guidance when necessary. An important lifetime ban to be aware of relates to the disclosure of confidential information. As a UConn or UConn Health employee, you may never disclose any confidential information learned during the course of your state service for anyone's financial gain. To learn more about what's considered confidential information, refer to the accompanying resource. Another lifetime ban is that you may never represent anyone other than the state regarding a particular matter in which you were personally or substantially involved while in state service and in which the state has a substantial interest. The State Code of Ethics also requires a cooling off period for 1 year after leaving state service, meaning that you may not represent anyone, including yourself, a business, or employer, other than the state for compensation before UConn or UConn Health during that period. For those who are retiring and may return to UConn or UConn Health as a rehired retiree, please note that the cooling off period does not begin until after your appointment ends as a rehired retiree. Be aware that you are also prohibited from being hired by a company or entity that was contracted with the state for a period of 1 year after leaving UConn or UConn Health, but only if the contract was valued at $50,000 or more, you were substantially involved in or supervised the negotiation or award of that contract, and it was signed within your last year at UConn or UConn Health. Now that we have all that information, let's analyze the scenario involving our friend Dr. Bowers. Are you ready? Okay. Because Dr. Bowers was part of the negotiations and awarding of the contract with the vendor that is offering her the job, the value of the contract is an important piece of the puzzle. Upon review, it looks like the contract Dr. Bowers helped solidify with the vendor, her prospective employer, was signed 5 years ago and was valued at $45,000. Since the contract went into effect 5 years ago and was under the $50,000 threshold, it would be permissible for Dr. Bowers to accept the position. That said, Dr. Bowers would need to remember she is not allowed to engage with UConn or UConn Health on behalf of her new employer for at least 1 year after leaving UConn. Nice work. Like Dr. Bowers, you may be thinking about leaving your position at UConn or UConn Health. It's important to remember the post-state employment provisions outlined in this clip. Ultimately, it's our individual responsibility to adhere to the State Code of Ethics, and any violations of the post-state employment rules could be enforced by the Office of State Ethics and result in fines up to $10,000 per violation. For more information on the State Code of Ethics and the post-state employment rules, go to compliance.uconn.edu or check out the accompanying resource for additional information.